The Idaho Department of Health and Welfare has released a first round of race and ethnicity data to give us a better idea of who is getting vaccinated. Our Ricardo Coronado looks at those numbers and explains why data is still pretty limited.
The Idaho Department of Health and Welfare has published COVID-19 vaccinations based on race and ethnicity.
This week, we now have 62% of our records containing race and a little over half of our records retaining information on ethnicity. And that's an improvement over previous, but we do have more improvements to go.
State health officials say people aren't required to provide their race or ethnicity to COVID-19 vaccine providers.
So if a patient comes to clinic to get vaccinated and wants to decline reporting their race and ethnicity, they have every right to do so. However, what we want to make sure we're getting is when that information is available, that's always coming to us.
The current data shows nearly 6,000 Hispanic or Latinos have received the vaccine. State epidemiologist Dr. Hahn believes two factors could explain the low numbers.
Maybe less healthcare access, maybe communication or language barriers, and knowing where to access vaccine, how to access vaccine. Again, we hope that improves. But also, as a reminder, our first groups of vaccinated people were mostly healthcare workers or seniors, and actually in those two populations, our Hispanic representation is lower.
Dr. Hahn believes the number will improve once more people become eligible to get the vaccine and vaccine availability increases. Race and ethnicity is one of many factors the state will be monitoring to ensure vaccine equity.
If you go on our site right now, you'll see there are some counties where they're doing a lot better with vaccination rates than other counties, and we are starting to laser focus on that and really try to figure out how can we support those counties to up their vaccination rates.
Ricardo Coronado, Idaho News 6.